Are you afraid your chronic pain will never end? Do you fear surgery is your only option? Or do you worry about addiction to pain pills and wonder if this might be worse than being untreated? Well, according to information from the Cleveland Clinic, narcotic dependence is now the most common complication of non-emergency surgery. And one University of Michigan study found that up to 6.5% of surgical patients prescribed opioids for the first time were still filling their prescriptions after 3 months. Have you ever wondered if there's a better way to manage pain? Well, according to Dr. Danesh Mazloomdoost, there is a much better way. Dr. Danesh is a regenerative medicine specialist, anesthesiologist, and pain specialist, #1 international bestseller, healthcare sector advisor, and international speaker, and he's been on the cutting edge of helping patients understand and manage their pain since 2005. During this time, he's treated over 15,000 patients and transitioned from a conventional approach to using more progressive, regenerative, and integrative techniques. Currently the Speaker of the House for the Kentucky Medical Association, Dr. Danesh frequently advises healthcare officials, political leaders, and Congress on the state and national levels. He's on a mission to change the way patients and doctors think about and treat pain as we move fully into this new millennium. Let's meet Dr. Danesh. All right, Dr. Danesh, it's great to have you here today.
Thank you for having me. I'm excited.
Yeah, me too. So you and your whole family have a long history in pain management. Why don't you talk a little bit about that?
Yeah, so my parents are both anesthesiologists like myself. When we immigrated to the U.S., my mom went into psychiatry and then my dad went into pain. And so together they set up Kentucky's first multidisciplinary pain clinic. I grew up there. I mean, my summers were spent sweeping the floors and checking in patients. So it was just kind of part of my upbringing, and it became one of the inspirations for me to go on into the same field and continue their legacy.
All right, and you also have quite a pedigree at Johns Hopkins and MD Anderson clinics. So how did your background in conventional medicine help shape who you became and how you've made the transition?
I was always interested in pain. I was kind of a clumsy kid, so I'd break a lot of bones. And it inspired me to really delve into what is pain, what does it feel like, and kind of the spiritual and emotional components as well as the physical. And so I wanted to get the best training. I wanted to learn from the best, and I really pursued that hard. And I think the world of my mentors in both institutions. I chose MD Anderson because I really wanted to learn about the complexity of cancer-related pain, since it really tests your anatomy and physiology understanding.
All right, so why don't you talk a little bit about some of the patients you've worked with and how you've been able to use your newer and your regenerative approach to helping them?
Yeah, so I'll give you an example. I had a patient, we'll call her Heather. She was a young 20-year-old, had a back injury, went to the doctor. This is a very common story. She got an image or an MRI. It showed a disc, and so her surgeon operated, didn't fix the pain. So she went back, and he operated again, this time fusing her back in somebody in her early 20s. She continued to have pain, so her surgeon started her on pain medications. By the time I saw her, she was in intractable pain, really bad pain. She was continuing to take high-dose opioids, and she was miserable. She stopped working, she was depressed, she felt awful. We started her on a multiple treatment plans and got her off her pain medicine, did some regenerative work, identified what really was the true cause of her pain. And now I rarely even see her. She's off her medication, she's back to work, she's happy. Now, I want to contrast that with another patient that I had who didn't have that same course. He actually, had a similar injury, but instead of going the conventional route, he had doctors that were astute enough to treat it in a more holistic, regenerative way. And he did really well. He actually never had surgery, never got on any pain medications, and he sits in front of you today.
So the bottom line is, not only have you been a patient, you've actually gone through the process yourself. You know what it's like to live with that kind of pain. So no one can say, Doc, you don't know what I'm going through.
That's true. I mean, I won't say it was an easy road. I had periods of depression. I had long physical therapy sessions. I worked really hard. And it's never perfect. Bodies never go back to what they were when they started. But I'm functional. I've never had surgery. I've never taken any drugs.
All right. So now you've evolved and developed a system you call the Wellward Way. And can you describe what the Wellward Way is and how it works?
Yeah, one of the problems in medicine right now is that we treat pain as a disease, and it's not. It's just a symptom. It's a messenger. And so what we have to do is start getting a better understanding of how to interpret this message. So our methodology starts with what we call pain mapping. It's a process by which we figure out what are the pinpoint origins of pain so that we can develop a treatment plan that really brings it all together and incorporates a solution that's sustainable, that has legs to continue to function. Our goal is, I always joke with my patients, I want to put myself out of business. I want to get you well enough where I don't have to see you back.
Very good. And because of your mindset, because of the fact that you've made this transition and you've got an incredible history of success, you're being called upon by Congress and also by a number of organizations in Kentucky where you live, but also beyond that as well on a national level. So why don't you talk about the work that you've been doing with the commissioner?
Yeah, so Kentucky is the epicenter for the opioid epidemic. We've got large numbers of patients that are opioid dependent. On top of that, we have one of the highest rates of disability in the country. So our workman's compensation system is just inundated. The commissioner in my state approached me after hearing me talk at one of my speeches, and he wanted to put together a group of physicians to revamp the guidelines, the protocols, the ways we approach pain, because we know that the systems we're using right now increase rates of disability. Opioids will increase your rate of disability. They'll increase the probability of having surgery. And the higher, the faster, the sooner, the worse it is. Now, I'll give you another example. So off of that, I've started working with one of the local hospital chains. It's the largest private hospital chain in our state. The chief medical officer approached me, similar situation, heard me speak somewhere, and he wanted me to help them develop some guidelines and protocols that would help the entire hospital system not only approach pain in a better way, but what I guaranteed him is that if we accomplish some of the goals that I'll set out for us, we will have higher patient satisfaction, better pain control, and less opioids. It's a win all around, and I know that we're going to get there as we work through it.
Very good, very good. So you really are setting the standard. Mm-hmm. Well, one other thing that I think would be a great story to share is the one about Dr. Shirazi and how you helped someone with cancer, but also complications.
Yeah, so this is a really good story because it's a demonstration of if we change our systems, we can prevent a lot of chronic pain from developing. Cancer is a difficult condition. 25% of women who have a mastectomy end up with chronic breast pain. And my goal was, how do we mitigate all of the downsides of cancer treatment and prevent them from developing to chronic issues? So before her mastectomy, I fought tooth and nail to get the right kind of anesthesia because I knew that this would reduce the likelihood of her developing any chronic pain. But the added bonus to that was she used 0 pain pills after her surgery. Now, this is amputation of part of your body, and she didn't use any pain pills. I think that's astounding because they're not clean drugs. They have a lot of downsides to them. But on top of that, she had a number of other complications that we were able to address. She got shingles because of the immune effect of her chemotherapy, and it was a really bad case. But she had radiation, and that caused weakness in the bones of her spine, so she actually fell and had a fracture. And I was able to capture the day of her fracture. Normally with fractures like that, people actually lose height, and that's why you see older people hunching over. But the fact that we were able to act on it the very day it happened.
And this is a spinal injury.
This is a spinal injury. I mean, she crushed this bone right here. It just collapsed.
Wow.
And since we got to it the same day, something that would normally take weeks and weeks to get, and sometimes not even get the right procedures, we were able to get 100% height restoration, like get it completely back to what it should be, and prevent her from hunching forward or developing other problems down the line.
Very impressive. And there's another really impressive part of this story that I think you may have left out.
So, yeah, she doesn't let me call her Dr. Shirazi. She makes me call her Mom. But yeah, I didn't want to embarrass her. But yeah, she's Superwoman. I know that not everybody can go through what she's gone through and do as well. But even Superwomen have their kryptonite, and I was glad to be able to shield her from that.
Yeah, that was really impressive. And it just, again, goes to show one of the reasons you're such a good doctor is because, A, you've experienced it yourself. You've had the good fortune of being able to work on your own mother, and now you're out there setting the standard for how medicine is going to be practiced, but also how people get treated, and also how drugs are being used as well.
The biggest problem we have right now in healthcare is when it comes to pain is that we marginalize patients to the point where they lose hope. The body has a lot of capacity to heal. We're not using that capacity. And if I can relay just one message to transform healthcare, it's that we need to re-inspire hope among our patients that we can do this without all the downsides we're seeing right now of pills and surgery and all the complications they bring.
It's great, and it's awesome that you're setting the stage and setting the standard, which leads us to you're now an international #1 best-selling author. You've got your book that you're giving away, and there's also a way to get hold of you for someone who wants to either work with you inside the hospital system or get you and hire you as an advisor. So how does someone get a copy of your book, learn more about how they can work with you?
So our website has our book, and for anybody who goes on there, we'd love to give you a free copy because there's a lot of information in there that I just wish to share with people, the healthcare industry, everybody. And if you go there, you will have some venues for getting in contact with me and being able to work with me both as a patient or as a advisor or consultant.
All right, and I do want to read the title of the book because it's genius. Unless you want to do it, you want to go ahead.
Yeah. So I got a lot of flack from this, but I'm proud of this. It's 50 Shades of Pain: How to Cheat on Your Surgeon with a Drug-Free Affair.
It's really brilliant, and you do bring some comedy to the circumstance and the situation.
Absolutely.
And also a way to resolve it too. So the place to go then is head on over to wellwardmed.com/report. That's where you can get a copy of the book. You can also learn about how you can work with Dr. Danesh.